If you want easy points on your exam, know the difference between Neuroleptic Malignant Syndrome and Serotonin Syndrome. First, let's talk about what causes these syndromes. Neuroleptic Malignant Syndrome is caused by dopamine antagonism, and that is why the classic culprits are antipsychotics. Serotonin Syndrome, on the other hand, is caused by serotonin excess. It is typically presented in a test question as someone that's taking something that increases serotonin, such as an antidepressant, along with something else that increases serotonin, such as a different type of antidepressant, tramadol, triptans, and they really like to test on St. John's wort, which is a supplement used for depression. Both syndromes involve altered mental status, hyperthermia, although the fever is very high in NMS, and autonomic instability, such as high blood pressure, tachycardia. They'll present with sweating. So how can we tell the difference between them? Neuroleptic Malignant Syndrome has the hallmark lead pipe rigidity, which is a generalized severe muscle stiffness. It also can present with decreased reflexes, as well as increased creatinine kinase and marked leukocytosis. Now, Serotonin Syndrome, on the other hand, is hyperdynamic. The key symptoms are myoclonus and tremor, as well as hyperreflexia, not hypo, hyper. They also can present with diarrhea and even ataxia. So once you figure out which syndrome it is, you need to know how to treat it. First-line management for both syndromes is very similar because both of them, it's discontinuing the offending agent and supportive care. Now for NMS, supportive care is going to include cooling and hydrating. And that's going to help with managing the fever because it's very high and preventing complications like kidney damage from the rhabdo. Specific agents that are specific to NMS that you might be tested on is dantrolene, which is a muscle relaxant for the rigidity and the hyperthermia. And they could also test you on bromocriptine, which is a dopamine agonist. Now for serotonin syndrome, supportive care might include benzodiazepines, and that's to control the agitation and muscle hyperactivity. You also might get tested on the specific antidote, and that is going to be cyproheptadine, which is a serotonin antagonist. But in real life, we don't actually use it that often. All right, so let's do a rapid review of the key differences, and then we'll jump into a couple of practice questions. Neuroleptic Malignant Syndrome, caused by dopamine antagonism. Serotonin Syndrome, caused by excess serotonin. Key presentation for Neuroleptic Malignant Syndrome, rigidity, decreased reflexes, very elevated CK, and marked leukocytosis. Serotonin Syndrome, key presentation, myoclonus, hyperreflexia, and possibly diarrhea. Treatment for NMS, stop the offending agent and provide supportive care. Possibly dantrolene or bromocriptine if they ask about an agent to treat the NMS. Serotonin Syndrome, stop the offending agent and supportive care. Antidote is cyproheptadine. Let's get started on practice questions. So, a 24-year-old male is admitted to the psychiatric unit for acute psychosis. 3 days later, the nurses note that he is acutely confused and spiking a fever. Examination reveals generalized muscle stiffness and significant diaphoresis. Deep tendon reflexes are noted to be diminished, and laboratory results show significantly elevated CK levels. What is the most likely diagnosis? A. Anticholinergic toxicity. B. Serotonin syndrome. C. Neuroleptic Malignant Syndrome. D. TCA overdose. Or E. Acute dystonia. The answer is NMS. And there are a few hints in this question that you need to pay attention to. There will probably be less hints on your actual exam. The man is being treated for a psychosis, so he's on an antipsychotic. He has a very high fever, and then he has generalized muscle stiffness, which is the classic lead pipe rigidity. He also has diminished reflexes and a very elevated CK. All of these point towards NMS. Next, we have a 35-year-old woman with a history of MDD controlled on sertraline who presents to the emergency department with severe anxiety, confusion, and a temperature of 101.5. Her husband reports she recently started taking St. John's wort, and on physical exam she is restless, diaphoretic, and exhibits rapid involuntary jerky movements and hyperreflexia on all four extremities. What is the most likely diagnosis? A. Neuroleptic Malignant Syndrome. B. Hypertensive crisis. C. Serotonin syndrome. D. Delirium tremens. Or E. Acute dystonia. So the answer is serotonin syndrome. And again, you probably will not have as many clues as this on your real exam, but these are the things to pay attention to. She's being treated for depression, so she's on sertraline, which increases serotonin. She also started taking another agent that increases serotonin, St. John's wort. They do like to test on that. She has these rapid involuntary jerking movements, which is myoclonus, and she also has hyperreflexia. All of these should point towards serotonin syndrome. Now you have some easy points for your exam. Good luck.